All right, good morning, everyone. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm here to provide an update to Manitobans on the COVID-19 situation, including some announcements regarding our second booster dose eligibility, as well as access to Paxlovid treatment. And we'll briefly speak about some of the influenza activity that we're seeing in the province as well. So we're going to start with an update on COVID and some of our modeling that we've acquired. If we look at the modeling deck, we see that the situation remains fairly stable in Manitoba. If we look here at the wastewater data, we see a fairly stable picture, potentially on the downward trend, and some of the waxing and waning as we would expect. But for the most part, looking at a stable picture. If we look at the next slide, we can see that this wave has been predominantly a BA2 wave. Almost all of our sequencing is BA2. We see our hospital admissions does appear that we've had a peak and things are trending in the right direction related to hospital admissions. If we look at the next slide, we see a similar picture with ICU admissions. Looking that we've likely peaked and seeing a downward trend in the ICU admissions. We know that our best protection against COVID-19 has been vaccination. And if we see our next slide, we can see that demonstrated. We've all seen these slides in the past. And if we look at those first two doses, how important those are, those that are what we would describe as fully vaccinated, two doses are 9 times, or people who aren't fully vaccinated are 9 times greater risk of hospitalization, 9 times greater risk of ICU, and 37 times greater risk of death. Compared to people who are fully vaccinated. And the next slide will just demonstrate that with that booster dose, the third dose for most people, where we see the people who are not vaccinated are 13 times greater risk of hospitalization, 22 times greater risk of ICU, and 32 times greater risk of death. So we really see that ongoing benefit from being vaccinated, and we know that's the best way to protect ourselves and even the people around us from COVID-19. And so next update is really on booster doses. So that fourth dose, the second booster dose, we are making some changes to expand our eligibility criteria for that. And so effective today, anyone age 50 and over can be eligible for their second booster dose, in keeping with our prior eligibility for First Nations, Inuit, and Métis people aged 30 and older. They will be eligible for a second booster dose, and adults who are moderately or severe immune compromised are eligible for their second booster as well. So we're also shortening the interval between doses. We're shortening that to 4 months. From 6 months. So any of the booster doses can be received within 4 months of your previous dose. And so again, we can see from those slides and from what we've seen throughout this pandemic, vaccination is our best way to protect ourselves. So please, if you haven't received your first, second, or third dose, please get that as soon as you're eligible. We can see how much protection that provides for people against those severe outcomes. So really encourage Manitobans to get whatever dose you are eligible for as soon as you become eligible for it. It's many places it's available, clinics, pharmacies, so please do get that vaccine dose as soon as possible. So even though vaccine is the best way to protect ourselves, we do have treatments available for COVID-19. We are expanding the criteria and access to Paxlovid, which is the oral antiviral, so a pill that you can take. We've had fairly tight criteria based on age and risk factors and vaccine status. We now have provided guidance to clinicians on things to consider on who can receive Paxlovid. You still need to be started on this medication within 5 days of symptom onset. So it's very important to have that early diagnosis and access to care. And if we're looking at that access, we have broadened that access to be available by prescription for Paxlovid. So Paxlovid is going to be available in more than 175 pharmacies across the province. And so we do want you to speak with your healthcare provider early on, because again, you have to start on this medication with 5 days of symptom onset. And so speak to your healthcare provider whether Paxlovid is right for you. And we've posted a list online of pharmacies where this will be available should you require it. We've seen, the impacts of COVID. We're still seeing those impacts of COVID, but we're also seeing other respiratory viruses circulate in the province. We're seeing influenza A activity, and so this is 18 lab-confirmed cases in the prior week of flu A. And so this is, we have various seasons, but this is typically later on in what we would normally have as a flu season. And so we've had 400,000 Manitobans already have received their flu shot. So if you hadn't had an opportunity to receive your flu shot, that's still open to you to get that flu shot, especially if you're at increased risk, those under 5, those over 65, those with underlying medical conditions. If you've already received your flu shot, there is not a requirement or an indication to receive another one this year. But if you haven't received your flu shot this year, it's still recommended to do so. And then we know that all the things we've become accustomed to in the spread of COVID-19 is also a beneficial influenza. Washing your hands, covering your cough, wearing a mask, and just staying home when ill. So that is the update for today. So happy to answer any questions.
What's the recommended interval for a booster shot? Assuming you've got 4 months, but what's the recommended interval after COVID infection now from you in this province?
It's 3 months following infection.
Any signs of monkeypox in Manitoba?
No, we are not. We don't have any cases under investigation in monkeypox right now. We're obviously following that situation quite closely and be communicating with healthcare providers shortly to ensure they're aware of what are the developments there.
Are you doing surveillance? Like we've heard from on the national level in Quebec that they're looking for. Asking clinicians and family doctors to look for signs on this. Has specific instruction gone out for monkeypox surveillance? Well,
this is going to be going out shortly, just to raise awareness and the type of things that they can look for.
Are you at all concerned about monkeypox coming to Manitoba, or?
Well, we have to be aware of it. Certainly seeing the cases in Canada now. There have been, outbreaks in the past in North America, certainly not here. So we have to be aware of it and recognize it, and just like any sort of emerging infection, have that high degree of suspicion early on to ensure we're dealing with any cases if they emerge.
You mentioned the number of people being admitted to hospital and being admitted to intensive care is down, but it isn't dropping quickly. It seems like this wave is particularly stubborn.
Right. Yeah. So we do see that, especially in the hospital and the ICU. We see that the numbers certainly aren't on a steep decline on the reports. Now, again, because there's such widespread transmission of this virus, we do see still a lot of incidental admissions. So when we do chart reviews in the hospital, about 79% of people admitted to hospital for COVID are there for non-COVID reasons, and about 40% in the ICU are there for COVID. The rest are there. So you do see a lot of that type infection just because of the widespread amount of transmission going on.
When are all Manitobans going to be eligible for that 4th dose?
Well, right now, we're looking at the evidence and reviewing that evidence and the benefit of the fourth dose. It's really important that those who are at higher risk of severe outcomes get that. It's very likely that come fall time, we're going to, again, require an immunization plan, potentially with other vaccines. So for right now, the second booster dose, we want to ensure people who are at highest risk of severe outcomes get that. It's unlikely that we're going to expand our fourth dose eligibility, second booster dose eligibility any further pending our fall campaign.
Dr. Roussin, as of May 14th, almost 4 people a day have been dying from COVID this calendar year alone. Compare that to the same 134-day period at the beginning of 2021. It's almost half of that, 3.9 this year, 2.1 last year. To what do you attribute a near doubling of COVID deaths compared to the same period last year?
So there's a number of factors at play. One is just the nature of Omicron, right? The way we see such widespread transmission compared to what we were dealing with before, wild type or alpha. So we do see just much more transmission. The other thing is just on the nature of that public health isn't investigating each of these cases. So just like in hospital where we see 75% of people admitted there with COVID aren't there for COVID. So it's very likely we're seeing things that are incidentally related. So it's always difficult to speak about, right? Because it's always tragic when someone loses a loved one. So not downplaying that in any way, right? Our condolences go out for anyone who's lost a loved one for any reason. But just the nature of the widespread transmission and the way that we're reporting it now, it's possible that we're seeing a lot of incidental.
I thought the way that the change of the definition of a COVID death would actually have reduced the number of reported COVID deaths. I understand. I mean, do you have an analysis that definitively suggests that that definition change has increased?
Well, we're going to. I mean, we are going to look at ways of better understanding this reported increase. But when you change the definition to more of a surveillance definition, it's a definition we use for influenza every year. It's if you died within 10 days before or 30 days after being tested positive for COVID-19, you will be counted as a COVID-19 death. So. In the past, we would have some review to see if it was an obvious cause other than COVID.
And Jason Kindrachek had said a couple of weeks ago that looking at the literature now, it's looking at Omicron is not as mild on the severity index that they originally thought, that it might be a little bit closer to Delta than he thought. He's, of course, summarizing a lot of literature. From what you've seen locally, is that proving true to you as well?
No, that's not what we're seeing from the data here now. I think that when you look at the daily cases that we were reporting at a time when we were doing a lot of testing in Delta, and you look at the amount of deaths, unfortunately, that we were seeing then, compared to what is widespread transmission in our Omicron and BA1, BA2, the fatality rate is much lower.
Are you monitoring, is Manitoba Public Health monitoring for the new Omicron subvariants that we're starting to see in other jurisdictions?
Yeah, we still sequence a subset of all samples that we take, and so we haven't seen BA4, BA5 here yet. Almost everything we sequence now is BA2.
How do you explain the province's delay in reporting our COVID deaths here in Manitoba?
Well, I think there's just it's reported to us in different ways now, right? In public health, we used to have each of these cases reported directly to us with a case investigation. Now they're receiving it from other sources. So there's a bit of a delay when they update that. But remember, this is very quick reporting, right? If we look at the way we report almost all other deaths through vital statistics and things, that takes weeks and weeks and weeks, and if not longer, to have. So these deaths are reported very quickly. And with that, you'll see then sometimes we've removed deaths, sometimes we've added some. And when we look at this retrospective analysis that we hope to do to give a better sense of of what's really behind the increase, we'll probably get some more information to share at that.
Have you contracted COVID?
I have not. I haven't had any symptoms, and I've done a lot of testing. So I haven't. Even a member of my household had COVID, very mild, and we all tested, but none of us tested positive.
Thank you very much, folks. And there is a bulletin coming out.